And the continual story of coronavirus continues, and that was two continues. But anyway, we're going to today talk about some things that just came out this morning. University of Texas at Austin, National Institutes of Health, information that is true. And one of the things that I've stressed over and over again in this show since its impetus 24 years ago is I don't buy into news sources that aren't reputable, fake news. So I will tell you always where this information comes from. So we're going to try to answer a couple questions. Number one, which is the headlines I put out, coronavirus spreads quickly, sometimes before people have symptoms. I don't know that that's new, but there's some information in here that I think you need to hear. We're going to also share a little bit about how to care for a cancer patient during all this. If you want to look at somebody who is probably the most susceptible to this, factor out diabetes, heart disease, all the other issues, it's somebody battling cancer. And then another one from the National Institutes of Health that basically asks the question, how long does this stuff really live on inanimate objects? So 3 articles, 3 stories, all pieces of the information we need to make sure you have as you're sitting at home discussing what needs to be done around the house. Focus, folks, on keeping your family safe. We're here, we're available for you Monday through Friday, 11 to 5. And on Saturday, I'll stress this again, we had almost 500 people view my post that I sent out saying I'm going to be available from 10 on, whatever long period of time we need on Saturday for any questions you have, and we had 0. So maybe this Saturday, if you have questions, you can save those. You want to ask them live. I'll see if I can come up with some answers. We'll do that again this upcoming Saturday. So let's start out from the University of Texas at Austin that said coronavirus spreads quickly and sometimes before people have symptoms. Keeping in mind that when you look at those artist drawings of coronavirus, looks like a little ball with little ports that come out of those. Well, that's a protein matrix that has developed around the core of this virus. It's there for protection of the virus. It's what keeps it hidden for a time from our immune system. So it does get into your body. It does start to cause problems, and it can take anywhere from 5 to 7 to 10 days before you actually have any symptoms. That's the hard part here, which is why I'm stressing over and over again, do not sit back and do nothing. At least take a lot of vitamin D and as much C as you can get, even though we can't get much C. Hey, by the way, tomorrow we're going to raise this question. Since this one, SARS, and almost all of the viruses that have wreaked around this country over the last couple of years seem to come from bats. We're going to try to answer that question. Why do these viruses come from bats? So make sure you tune in tomorrow. Infectious disease researchers at the University of Texas at Austin studying the novel coronavirus were able to identify how quickly the virus can spread, a factor that may help public health officials in their effort at containment. They found the time between cases in a chain of transmission less than a week, so less than 7 days, and that more than 10% of the patients are infected by somebody who has the virus but doesn't have any symptoms. That's what's making this extremely difficult. This was the whole risk factor with kids going down to spring break and even coming back because they're young, not having any kind of issues, but maybe being a carrier. In a paper at the Journal of Emerging Infectious Disease, a team of scientists in the United States, France, China, and Hong Kong were able to calculate what they called the serial interval of the virus. To measure the serial interval, scientists took the time it takes for the symptoms to appear in 2 people with the virus, the person who infects the other, and the infected second person. Researchers found that the average serial interval for the novel coronavirus in China was approximately 4 days. This is also among the first studies to estimate the rate of asymptomatic transmission. Is it a problem for somebody that has absolutely no symptoms, or maybe just a little bit of a scratchy throat, and their immune system is so strong they're actually fighting this off? The speed of the epidemic depends on 2 things: how many people each case infects and how long it takes for the infection between people to spread. The first quality is called the reproduction number. The second is the interview. The short serial interview of COVID-19 means emerging outbreaks will grow quickly and could be difficult to stop. Ebola, with a serial interview of several weeks, is much easier to contain than influenza, with a serial interview of only a few days. Public health responders of Ebola outbreaks have much more time to identify and isolate cases before they infect others. Myers and her team examined more than 450 infection cases from 93 cities in China and found the strongest evidence yet that people without symptoms must be transmitting the virus, known as pre-symptomatic transmission. According to the paper, more than 1 in 10 infections were from people who had the virus but didn't yet feel sick. That's the scary part. Wash your hands. Don't touch your face. Don't put your fingers in your mouth. Don't scratch your eyes, even though the pollen counts through the roof. This provides evidence that extensive control measures, including isolation, quarantine, school closures, travel restrictions, and cancellations of mass gathering, may be warranted. We just got a call that after we played golf last week, we all got together outside and sat around a fire pit. We kept our distance, but the golf course now is mandated that we don't even do that. It's gotten to that point where they're saying, nope, stay away. 1 person per cart and stay away. Myers pointed out that with hundreds of new cases emerging around the world every day, the data may offer a different picture over time. Our findings may be corroborated by instances of silent transmission and rising case counts in hundreds of cities worldwide. Research was funded by the United States National Institutes of Health. Now, that's depressing. How to manage cancer care during a COVID-19 pandemic. Experts from the Seattle Cancer Care Alliance, a member institution of the National Comprehensive Cancer Network, are sharing insights and advice on how to continue providing optimal cancer care during this novel coronavirus. This included the Fred Hutchinson Cancer Research Center and the University of Washington, which were located in the epicenter of the outbreak in the United States. Responding quickly and confidently to the crisis is the healthcare challenge of our generation. I'm going to skip to the end of this article that said, we know what the challenges are. Here's some of the recommendations. See what you think. Providing patient information via handouts, signs, web-based communications, and a dedicated phone line for questions and triage. Rescheduling well visits and elective surgeries and deferring second opinion consultations. Increasing hours of general hospital operations to reduce the unnecessary use of the emergency department. Reinforcing a strict stay-at-home when ill policy and ensuring staff have access to testing. Restricting travel and enabling work from home whenever possible. Prioritizing the use of soap and water over those hand gels. Did you hear what I said? Limiting the number of team members who enter the patient's room, considering low thresholds for blood transfusions. Moving some procedures from inpatient to out. Adopting a no visitor policy, with rare exceptions. Having upfront, proactive, palliative, and end-of-life conversations with cancer patients who may be infected. That's scary. The article also addresses the importance of self-care. Self-care. Even if you do have cancer. Been there, done that. Doing something to protect yourself. There are so many, I don't want to spend all the time. You can go back and listen to some of our other YouTube videos and all the different ways that you can effectively help yourself. But do something. If you need help with that, call and set up a time. We can chat this way through Zoom Internet and try to come up with some ideas for you. 678-228-8900. National Institutes of Allergy and Infectious Disease. The virus that causes coronavirus is stable for several hours to days in aerosols and also on surfaces, according to a new study from the National Institutes of Health, published in the New England Journal of Medicine this morning. Scientists found that severe acute respiratory symptoms of coronavirus was detectable in aerosols for up to 3 hours, up to 4 hours on copper, 24 hours on cardboard, which is unbelievable, and up to 2 to 3 days on plastic and stainless steel. The results provide key information about the stability of the COVID-19 suggests that people may acquire the virus through the air after touching contaminated objects. Study information was widely shared during the past 2 weeks after researchers placed the contents on a preprint server to quickly share the data with colleagues. So, scientists added additional information. If the viability of the two coronaviruses are similar, why is coronavirus 2 resulting in more cases? Emerging evidence suggests that people infected with coronavirus might be spreading the virus without recognizing or prior to recognizing symptoms. This would make disease control measures that were effective against coronavirus 1 less effective against its successor. In contrast to SARS, most secondary cases of virus transmission appear to be occurring in community settings rather than the healthcare systems. However, healthcare systems are also vulnerable to the introduction and spread of SARS-2. The findings affirm the guidance from public health officials to use precautions similar to those for influenza and other respiratory. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you're sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray. Don't have to use alcohol all the time. Some more information. Tomorrow we're going to try to go into bat viruses and why that becomes a problem, and how some patients seem to have coronavirus even after all their symptoms disappear. So it's going to be a lot of heads up for all of us. Just got some buffered vitamin C in this morning. We've been out of it for weeks. Maybe we're starting to get our supply chains back. So again, we'll keep you posted on all of that. If you have any questions or comments, you can reach out to us through our website at thenutritionshop.net or call us directly here, 678-228-8900. Share this, won't you, with others, and like and sign up for our YouTube page so we can get this thing out to the world. Have a great, healthy day, folks, and we'll see you back here tomorrow. Take care.